Since returning back after closure due to COVID-19, I've seen specific increases in certain dental maladies. Let's discuss those as well as their causes over the next couple videos. Here's part one. Roll that intro. What's up everyone, Dr. Eric Jackson here. Hope you're all doing well. I wanted to begin a multi-part discussion about specific dental maladies that I've seen a great increase in since COVID-19, the pandemic began, and since we reopened here for the last 3 months. So we reopened on June 1st, and we were able to start seeing patients normally again after seeing them for emergency only. In the last 3 months or so, there's been some significant patterns. We've seen an increase in a lot of specific, unique dental maladies, right? Generalized gingivitis, nearly all the patients. We've seen increase in jaw and TMJ pain, increase in cases of tooth sensitivity, increases in headaches reported, increases in sore head and neck muscles. And then finally, the most significant, we've seen a significant increase in tooth fractures. Last week, I'll be showing this case here as part of our discussion. A couple days ago, had a brand new patient come in, and he sheared more or less, you'll see the anterior 40% of his lower incisor off. What's going on? Why is this happening? And maybe this is happening to you. Maybe you've had this happen. Maybe you have some friends that have happened. Dental problems like these don't happen at this regularity and at this frequency. So what's going on? Well, I think the most common answer, the most logical answer is stress. COVID-19 is stressful. It's caused stress that permeates through our entire life, and it affects people differently. They've been using that phrase, we're all in this together, but we're not in the same boat. I think that's a pretty good way to summarize things because, yes, we are all impacted by COVID-19. The rules and regulations around you are probably similar, but yet not identical to the ones around me, and vice versa. But really, it comes down to the stresses are also unique to us. Some people carry their stress in their necks and back. Some people carry it without any real outward appearance. No musculature issues. So what are these kinds of stressors, right? Well, we don't need to get into every single one because I think that's actually quite impossible. There are so many different types of stresses out there right now. It is a unique time in the history frankly, of mankind. But I think we can categorize them, at least in my neck of the woods, in my life personally, as 3 categories. First, biological stressors, right? You want to keep your family healthy and safe from the actual virus itself, and you work accordingly to do so. You also want to make sure that your life don't stop, and so you're socializing safely according to the guidelines and rules, number of people, distancing, masks, etc. That's a lot of work. It's a lot of stress to keep on top of things, whether you're one person living alone, single, whether you're married with 10 kids. There's a lot that goes into each person's life when it comes to biological stresses. There's also work stresses. People working, people not working, people that were furloughed, people that were let go. Are you on unemployment? Are you not on unemployment? Will you get your exact job back? Will you get a similar job back in a different location? There are tremendous HR questions out there for most people. Maybe those have been cleared up if you're back to work at the same job, but a lot of people just can't work remotely. We in dentistry, we don't have a remote in option, obviously. We are hands-on, like most people are. If you have one of those jobs that you're able to remote in, or at least partially remote in, that's excellent. I know that's not without stress, however, that has its own types of things. But with that said, hands-on in the dental field was pretty stressful for a while there. And it really hasn't gone away. It's not like it's just all of a sudden cleared up, right? The third stressor category I'm going to suggest is educational. I've got 4 young children, and I'll say I feel for every single parent it's a really difficult time because the educational system, it bleeds into the work stress. It bleeds into the biological stress. It really is kind of, at present, the hub of all the stress, because you maybe are wonderful at taking care of the biologicals at your family, but now we're not all quarantined at home. So you have to venture out and do certain things. Maybe you're remote learning 100%. Maybe you're hybrid learning partially, and you're in and out of the school. That creates a lot of stuff. A lot of stuff to freak out about, frankly. And I find it hard for myself. I know I speak for my wife. It's overwhelming at times. We've got remote learning, hybrid learning. There are childcare issues. What do I do with my child when I go to work? I got to put food on the table. How do I actually possibly make this work when I've got young children and a job and I can't leave them alone and they need my help to learn because they have to make sure that they're on time and scheduled at home? This is something that modern parents are dealing with that I don't think has ever really happened in society before, and certainly not to this extent. Juggling schedules throughout the day, even if you're able to figure this out. Maybe you're able to bring your child to work with you. Maybe you're able to have a grandparent, or maybe you're able to have a stay-at-home parent, and maybe that doesn't mean that you're off the hook. You still got to juggle everybody's schedule, and you've got to juggle different age brackets. Daycares are full; they never really shut down. Preschools, most preschools are 5 days a week or so. Grade schools in general are kind of remote or hybrid or whatnot. Colleges are almost they're kind of evolving currently as I'm recording this, but they're kind of going towards remote only, but they're still living on campus. Every level of parenting, every level of childhood, and therefore all the different types of the levels of parenting out there are all different, and you're juggling these just like you're juggling a bunch of balls or spinning a bunch of plates. This is stressful. And what we've been seeing is all these stress-related dental maladies coming home to roost. So, what are we going to do about this? Well, in the next video, we're going to talk about how we can combat stress-related, COVID-19 related maladies like we've talked about. Gingivitis, jaw TMJ pain, tooth sensitivity, headaches, sore head and neck muscles, tooth fracture. How can we protect against these, and how can we solve them if we already have them? So thanks for listening. I appreciate it very much. I will continue with part 2 of this series here in a little bit. As always, appreciate your viewership. Like the video. Please subscribe to the channel and make sure you hit the bell when you get so you can get notifications. And I'll see you in the next video. Thanks so much. Bye-bye now.